You're 70, maybe 72. You walk into the clinic for your routine checkup. You feel fine. But they order another scan, another blood draw, another screening. Sounds responsible, right? But what if I told you some of those routine checkups might actually shorten your life? Not just waste your time, but harm you. Overdiagnosis. Overtreatment. Side effects from tests you never needed. And here's the terrifying part. No one warns seniors about this. In fact, one study found that nearly 1 in 3 older adults are exposed to unnecessary and risky tests every single year. So before your next checkup, you must hear this. Here's what happens when you don't question routine tests after 70. You get a scan. It shows a shadow. Doctors panic. Biopsy, then surgery, then complications, then pain pills. Guess what? The shadow was harmless. According to JAMA Internal Medicine, over 60% of prostate cancers detected by PSA tests after age 70 would never cause harm. Yet most patients are treated anyway. Radiation, incontinence, impotence. For a cancer that wouldn't have even touched their life. This isn't about skipping care. This is about being smarter with care. Because over-screening isn't prevention. It's a trap. And it's costing thousands of seniors their independence, their health, and even their life. Let's start with this. The U.S. Preventive Services Task Force, the gold standard, now advises against routine PSA tests for men over 70. Why? Because the risks outweigh the benefits. False alarms are common, and when you panic and intervene, you risk infections, surgeries, even strokes. Same goes for certain colonoscopies, EKGs, and even some mammograms after 75. So what should you do instead? Let's break down 5 health checkups most seniors should avoid after 70, and what to do instead. 1. PSA test for prostate cancer. After 70, it may do more harm than good. Prostate cancer sounds scary. That word, cancer, can shake anyone. But here's what no one tells you. By the time men hit 80, up to 80% of them have prostate cancer cells. But here's the twist. Most of them die with it, not from it. According to Harvard Health and Mayo Clinic, the vast majority of prostate cancers in older men are slow-growing and harmless. They sit there quietly, never spreading, never threatening your life. So what's the danger? The PSA test, or prostate-specific antigen test, often detects these tiny, slow-growing cancers. And once it does, the fear kicks in. Doctors act fast, patients panic. And what follows? Surgery, radiation, hormone therapy. All of which come with life-altering side effects: urinary incontinence, erectile dysfunction, depression, and emotional distress. And here's the shocking part. According to the National Institutes of Health, PSA testing after age 70 has virtually zero effect on overall survival. In other words, it rarely saves lives, but often ruins the quality of them. Many men go through aggressive treatments for cancers that never would have harmed them. That's not prevention, that's punishment. What should you do instead? If you're healthy, active, and have a strong family history of prostate cancer, yes, have a serious, informed talk with your urologist. But if you're blindly taking the PSA test every year just to be safe, stop. Because at this age, more testing doesn't mean more safety. It often means more risk, more worry, and less freedom. And here's the kicker. There's a natural nutrient that protects your prostate better than most tests ever could. Stick around. We'll reveal that in just a moment. 2. Mammograms. After 75, may catch harmless cancers, not save lives. Ladies, I know mammograms feel like routine. But after 75, you might just be detecting tumors that would never hurt you. A Stanford Medicine review found that mammography in women over 75 leads to high false positives and overtreatment. Translation: painful biopsies, anxiety, unnecessary radiation, and surgeries for growths that may never turn deadly. The U.S. Preventive Services Task Force, they found no conclusive evidence that mammograms improve survival after 75. Why? Because age-related breast changes cause more false alarms, and the body becomes more vulnerable to treatment complications. What to do instead? Discuss risk with your doctor. If you're healthy, have a strong family history, and want screening, fine. But make it a conscious decision, not a reflex. I'll show you a powerful daily anti-inflammatory food later that reduces breast cancer risk without radiation. 3. Routine colonoscopies. After 75, dangerous and less beneficial. Colon cancer is deadly, yes. But colonoscopies? After 75, they become riskier than the disease in many cases. Here's why. Sedation becomes more dangerous with age. Colon walls thin out. Perforation risk increases. Bowel prep can dehydrate seniors dangerously fast. According to Mayo Clinic, the risks from colonoscopy start to outweigh benefits after age 75, especially if you've had clean results before, and yet doctors still push for them. Even though the American College of Physicians warns against routine colonoscopy after 75, unless there are new symptoms. What to do instead? If you're asymptomatic, consider non-invasive stool tests. They're safer, accurate, and don't require sedation or hospitalization. In a moment, I'll show you a simple food swap that can cut your colon cancer risk by 60%. 4. Annual EKGs. Unnecessary unless you have symptoms. Let's get real. Heart disease is a top killer. But EKGs? The machine may look impressive, but after 70, it often lies. A Cleveland Clinic report found routine EKGs in healthy seniors lead to false positives, which leads to stress tests, angiograms. Sometimes stents you didn't need. You feel fine until they tell you your heart's in trouble. But the truth? You may have a harmless rhythm variation common in seniors. What to do instead? Only get EKGs if you're experiencing chest pain, breathlessness, palpitations, dizziness. No symptoms? No need. Walk. Eat real food. Track blood pressure. That's better heart prevention than wires and beeping screens. 5. Full body scans from private clinics. Fear selling, not science. You've seen the ads. Detect cancer before it spreads. Book your full body scan today. Sounds promising, right? Nope, it's a trap. FDA and Harvard Health both warn. Full body CT scans expose you to large doses of radiation without clear benefit. One scan caught your hundreds of chest X-rays. They often find harmless lumps that spiral into a diagnostic nightmare. False alarms, whoosh, fear, whoosh, invasive procedures, whoosh, damage, and the worst part? They're marketed directly to seniors, playing on your fear of death. What to do instead? Stick to age-appropriate screenings. Avoid any private scan service not recommended by your doctor. Prevention isn't about chasing every shadow. Most doctors won't tell you this. Screening doesn't always mean prevention, and after 70, chasing diseases before symptoms appear can actually cause more suffering. The British Medical Journal warns, overdiagnosis is now one of the biggest threats to senior health. Why? Because we're treating people, not diseases. Most people are told, catch it early. But new research shows that for seniors, catching everything often means catching too much. We must shift the goal from detect more to live better. Major daily habit or mistake to avoid. You want to stay healthy after 70? Then stop this daily mistake, believing that more testing woes your more control. That's fear talking. The truth? Over-monitoring creates stress, side effects, and sometimes actual harm. What to do instead? Move daily. Even 20 minutes of walking lowers cancer and heart risk. Eat anti-inflammatory foods, Berries, green tea, turmeric sleep, 7+ hours. Your brain clears toxins only during deep sleep. Laugh, hug, go outside. They lower cortisol more than pills. And ask your doctor a powerful question. What happens if I do nothing? It might save you years of unnecessary stress, pain, and side effects. Look, I'm not anti-doctor. I'm pro-smart doctor. There's a difference. The smartest thing you can do after 70? Choose quality over quantity. Less panic, more presence, fewer scans, more sunsets. Because sometimes the best medicine is knowing when not to take any.